So this leads us to discuss the POLARIX trial. So the POLARIX trial was another attempt to basically improve upon outcomes for our patients. So it was a phase 3 randomized trial, which randomized patients to either R-CHOP, which was the standard of care, or what we call POLARIX. So POLA stands for Polatuzumab. And basically the way it works is it's an antibody drug conjugate. So it's specific. So it is a type of chemotherapy, but it is specific basically for those lymphocytes. So instead of going everywhere in your body, it targets the abnormal B cells. The way it does that is it attaches to the B cell receptor. So you can see there's two parts of the B cell receptor. It attaches to CD79B. Attaches to that, it is taken into the cell, and then it releases the chemotherapy directly inside the cancer cell. So I like this study for several reasons. One is that the median age was 65. So it did include older patients in the study, which I do think is important because, you know, lymphoma can be diagnosed obviously in our older patients, and we don't want to exclude them from clinical trials. They also included a lot of patients who had advanced disease, so either stage 3 or stage 4, and they included people who had higher IPI scores and higher LDH, which is just a lab value that we can measure with lymphoma. So basically it included patients who had a lot of high-risk features, which I think is important. So overall, you know, the primary endpoint of the study was something we call progression-free survival, which includes progression, relapse, or death from any cause. At the time of the data cutoff in 2021, originally patients had been followed for about 28 months, and the PFS was found to be significantly higher in the patients who got POLA-R-CHP over the patients who got the standard of care chemotherapy with R-CHOP. When they did a longer follow-up analysis of over 40 months, they found that the benefit was sustained and that there was an absolute difference of 3-year progression-free survival of 7.7%. One thing that is important about the study is that not everybody benefited. So overall, they did find a benefit, but when they looked a little bit more closely at who benefited, they found that not everybody benefited the same way. So they found that patients that didn't benefit were patients who were 60 years old or younger, which is actually interesting because you would assume that patients who are younger could handle, you know, different drugs a little bit better. Patients with something known as the germinal center B cell type of diffuse large B-cell lymphoma also didn't benefit as much. Patients who had bulky disease and patients who had lower IPI scores. So if you look at it, it's really the patients who had, you know, again, some worse features, including higher age, actually did better. In terms of adverse effects, I would say they were pretty similar between the two groups. The most common complication is always peripheral neuropathy. The Polatuzumab does cause peripheral neuropathy, and in the R-CHOP, one of the other drugs called vincristine can also cause peripheral neuropathy. And then we saw a lot of side effects that are just very common with chemotherapy overall, like nausea, vomiting, diarrhea, low blood counts, and anemia. This drug was approved in 2023 for patients, adult patients with previously untreated diffuse large B-cell lymphoma, but only for patients who actually had an IPI score of 2 or higher. So only for those patients in the high-risk group. So why is this trial important? This is the first trial that really shows any significant benefit without increased toxicity over R-CHOP, and it was really practice-changing for many physicians. So when do I personally use R-CHOP? So I only use R-CHOP for patients who have the non-germinal center type, just because in the subgroup analysis, it did not find any benefit in mostly the germinal cell type. And I use it for my older patients who have higher risk features. And overall, they've been doing really well.